Hello, I am Dr. Naveen Mehrotra, Chief Consultant Neurosurgeon at the KIMS Sunshine Hospital. So these days we are hearing very often that somebody's relative or friends or family members have got headache, and once the MRI was done and they found that the patient is having a brain tumor. So once we hear about the word brain tumor, there are a lot of fear amongst our mind, and we have a lot of myths associated with that. We feel that probably once brain tumor has happened, it means the end of life, and we feel that probably we'll be disabled. So today I am going to clear or tell you some facts about the brain tumor and remove some of the myths associated with brain tumor. So number one, brain tumors have really associated with lot of myths, but with recent advances, we are able to give a very good outcomes in majority of the cases with benign brain tumors. So number one, what is a tumor? A tumor means that it's an uncontrolled cell growth. So suppose, for example, we all must have got or injured sometime in our childhood, and when we see that after some time that injury heals and it becomes normal. So that is all because of the cell growth or healing which happens in the body. So when this cell growth becomes uncontrolled or it is on its own, then it is called as a tumorous growth. So the tumor can be of two types. For number one, it can be benign, that is non-cancerous, and second means malignancy or cancerous growth. So cancerous growths are not good, but for benign tumors we have got good or satisfactory outcomes. Then second question comes, what are the symptoms of brain tumor? How will I know that I have a brain tumor? Second, headache is one of the commonest symptom associated with brain tumor. So second question which comes to our mind is that we all get headaches. How to know that this is associated with tumor or not? So number one, if we are having a headache over a period of time that is changing its character, frequency and severity, meaning thereby that the headache is becoming more and more constant, it is present almost throughout the day, the severity of the headache is increasing, any headache that is occurring especially in the morning, and when you get up it is associated with vomiting, these are not good signs, and for that we definitely need to have a consultant or a physician opinion to find out what may be the cause for this headache. Number one. Number two, any headache which is associated with visual blurring. It means that the vision is getting affected, or you are seeing double vision with it, or you feel that the field of vision is not normal. So once these happens, it definitely means it needs investigation to rule out whether this is associated with the brain tumor or not. Any headache which is associated with seizure activity, fits activity, there are different types of fits, but any fits which affects one side of the body definitely needs investigation or evaluation to rule out any associated lesion with it. Number four, any difficulty in walking. You see a child which has got difficulty in walking, or the balance is not correct. If we feel that that's happening in the adult person and he walks like the person who has taken drink, then it means, or that is in word called as ataxia, that needs to be evaluated. Now, other than that, if you feel that the child is becoming more obese, or any endocrine abnormalities are associated, like a thyroid problem is becoming more, you're getting uncontrolled sugars, or you are getting sexual dysfunction, then probably this may be associated with pituitary tumors and they need to be evaluated. Second thing is having fits or seizures. These are one of the commonest things with which a patient may present, and it's likely that we should have our investigation with or rule out tumor. So now once we know these symptoms, then the second question comes, how to confirm that whether I have a tumor or not. So MRI of the brain is the investigation of choice to confirm whether the patient has tumor or not. And especially if we do a contrast study that shows the tumor very well in location or in association with the surrounding structures. Apart, other investigations are also required, like eye checkup is required, hearing test is also required. Then the next thing comes, what is the treatment for these brain tumors? So the treatment for brain tumors is doing a surgery and removing these tumors. So opening of the skull to remove the tumor is called as craniotomy. Now with recent advances, we are doing these surgeries with minimally invasive techniques like keyhole or endoscopic. So it depends upon what is the location of the tumor and what can be done for that. Then after the surgery comes the question, what is the outcome for this tumor? So we have seen and that there are a lot of patients who have benign tumor are having a good outcome. When we are saying good outcome, it means that they are able to go back to their life, they are able to rejoin their work and are able to lead a near normal life with certain caveats or requiring some medications to prevent seizures. Cancerous tumors, they do not have a good outcome, but still they can have a good quality of life when the tumors are removed. And after the tumors are removed, they require which is called as a radiation or a chemotherapy. And a combination of this is the one which gets a good outcome. So any patient who has a headache which is not improving or who has got a previous surgery done for tumor but is having recurrence of headache needs an evaluation to find out whether the tumor is happening or not. For any such query which you have, so you can consult us at the Sunshine Hospital, KIMS Sunshine Hospital, to find out whether you have a tumor or not.